Hello, William Reiner here, a child psychiatrist and urologist, ready to talk about some issues that come up frequently, actually, with parents, especially of kids with exstrophy. One question that I hear and have heard off and on, mostly on, for the last 35 or 40 years in my career is a question that I hear not just from parents, but I also hear it from the surgeons, and that is, when is my child ready for surgery? That's a leading question, which I'll get into in a minute. I can say that this topic could also be, when is my child ready for ... procedures and a number of other issues that come up. So those are actually questions that parents have often. Anyway, the answer though about when is your child ready for surgery, the answer to that question is, I think, really very simple, and that is probably never. So if you're interested in getting your child to the point where your child is ready for surgery, your child is not going to get to that point, with rare exception. There are the opposites of the rare exception. That is the exception that when the parent allows the child to make the decision, and the child makes a decision by not making a decision, which then becomes not making a decision, and 10 years later the child is still incontinent, except that the child's now getting awfully close to adulthood. So what's the motivation for children not being ready? And I mean that seriously. Children are really not ready. They may say they are, because children often answer to questions that adults put to them. They often answer those questions in ways they think the adult wants to hear. Sometimes they don't really understand the question, and sometimes they don't fully understand their own answer. They certainly don't understand the implications of their answers frequently. So what are the motivations of the child? Well, the primary motivation of the child for never being ready is fear. And the second, that's the first. The secondary motivation is anxiety, which is another way of saying fear. The third motivation is worry, especially about pain associated with anesthesia, surgery, whatever, which is also another way of saying fear. They also have experience with procedures and surgery and interactions with doctors and nurses, which leads to, you got it, fear. And the other aspect, and this is not a minor one either, any surgery for the child, I don't care how experienced, is going to be an unknown. So it's the great unknown, which leads to fear in probably all of us. So you're asking the child to be ready in a way that children simply are too young to be ready for. So when is a child really ready for surgery? Well, the real answer is when the parents are ready for the surgery to be done. But that really needs to be couched in the considerations of the child development, or the developmental aspects of their child, which for most children are very similar, but there are children who are outliers in both directions. And also remembering that you aren't going to be able to avoid fear in your child, or another way of putting that is, your child is not going to be able to avoid fear. That's simply a part of growing up. So things happen, they scare us. Children are not very prepared for being scared because they don't have the experience or the coping mechanisms. So it's up to us to cope for them when procedures and surgeries have to be done from a child development standpoint that the child is not really going to be ready for in any meaningful sense of the word. It's actually important for the parents to be confident about these decisions, at least around their child, because if the parent isn't confident, and if the parent shows any kind of questioning or worry that the child might not be ready, guess who figures that out? The worry is figured out by the child, who then worries. So you see, I've brought up this whole aspect of anxiety and stress for the child over and over again. It's a reality with surgery. It's not going to go away. So the question is the surgery necessary?